It's a great pleasure for me to introduce to you another of Keio's finest, Dr. Hiroki Nakatani, who right now is what is project professor at Keio's University's Global Research Institute. But before that, before arriving at Keio University, he was World Health Organization's Assistant Director General in charge of infectious diseases. I mean, of course, what more appropriate person to have? And of course, he has a long career at our own government, the Ministry of Health and Welfare. So he has lots of things to tell, but among that, today he is offering to talk about information-driven public health in an aging society. So with that, let me invite Dr. Nakatani. Can we just call you Hiro?
Yes, please. That is my name is quite mouthful, so please call me Hiro. That will be simple enough.
Thank you very much.
Thank you. So glad to be with you. May I start?
Yes, please do.
Because I prepared a few slides, but I know that this Swedish audience, I think, talk to other person is something like torture. So I will make it very short, and then I would like to answer questions. But I was told by Kokurio Sensei that easy question will be answered by me, and difficult questions will be answered by Dr. Kokurio. So that is what I have heard. And let me start by presenting my prepared slide, but I will go quite quickly. Can you see my slides?
Yes.
Okay, so I try to make it in presentation form. Is it clear enough? Is all right?
Yeah, that's good.
Okay,
yeah.
So it was just 13 months ago. I was sitting next to Dr. Tedros Ghebreyesus, Director General of WHO, who just came back from Beijing after meeting Mr. Xi Jinping. And Dr. Tedros said that, well, China is tackling a new virus with an unprecedented manners and in unprecedented scale. So the world can be saved, even if there's few cases outside of China. But situation become growing into a pandemic. It lasts for last 13 months. So today I would start from impact of COVID and then going to another problem of aging that is common in Asia, particularly in Japan, and how data-driven public health can solve these challenges. So that is my focus of presentation. So I would like to speak 3 points: setting scene, how public health system have responded to COVID-19 pandemic. Second, quest for information-driven public health. Third, challenges and opportunities, and question and answers. So that is 3 points I would like to go first. Public health is, I think, very broad term. The definition of public health usually we take is the one which appeared here, the art and science of preventing diseases, prolongation life, and promoting health through the organized effort of society. So this is not patient-doctor relations. That is clinical medicine. So we are looking at population as a whole. And health is defined as complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So social well-being is very important factor of health. That's why isolation is one of the serious problems in public health in aging society, and also particularly under Corona. But the definition of health and ill health is changing. Used to be health and ill health or disease is very clearly distinguished by incidents such as infection. But now this relationship is understood to be graduation type, like healthy and poor, and there's in between, which are influenced by health behavior, genetic factor, social determinant health, and environment. If we move these factors, if this graduation move to ill health part, sometimes move to healthy part. So that here, there's a role of public health. And information gathered in other sector is very useful. What is contributing as social determinants of health to general population? For example, one ward in Tokyo, Adachi ward, is quite notorious. Their healthy life expectancy is 2 years younger than or shorter than average Japanese. Why? There is social determinants that is coming in. So their behavior is analyzed. That comes from mass data. So that is we are using in public health. Let's look at pandemic of COVID-19. Now, more than 110 million persons are affected or infected, and more than 2 million persons died. And that is a 2 million deaths is equal to number 6 ranking cause of death in the world. And in the United States, that is quite striking that already 400,000 people died. That is more than deaths due to World War II for America. But if you look at geographical distribution of deaths is concerned, this is yellow is America, green is Europe, and purple is Southeast Asia, where India locates. And Africa is very small, and Western Pacific, where China, Japan, Korea, Australia belongs, is not seeable, which means it's very interesting. Global Health has been looking at poor countries' health, but now wealthy countries or middle-income countries in Americas, both America and North America. North America is high-income countries, and South America is middle-income countries, very heavily influenced. But Africa is influenced is very small. So that is changing concept of international health. International health is now regarded as not merely charity of developed countries to poor countries. That is global health for everyone. But if you look at the mortality by countries, Asia's performance is very good. This is a log chart. And here, bottom is China, Vietnam, Thailand, Singapore, South Korea. They are doing very well. And Japan is doing well among G7 countries, which is listed here. United Kingdom is quite bad. United States is not so good. And Japan located here, much better than G7 counterparts, but not good among Asians. So it is interesting. Davos conference, that is first of the year's major event of public and private sector dialogue in Davos, Switzerland. That is symbol of wealth and power. But now, this year's World Economic Forum moves to Singapore. So that is very symbolic. That center of gravity of the world is moving to Asia. I don't know. But if you look at this, COVID-19 deaths per million people by 19th of February. Darker colors means more deaths. Asia is white, which means less affected by pandemics. That is influencing to economy as well. Economic decline in the second quarter of 2020 is concerned. China quickly recovered and the plus, but other countries, Taiwan, South Korea, and Japan, decline of GDP is less than developed countries. So which means really the world is changing. But how WHO, or what challenges WHO recognized? Usually this every year WHO declares 10 risk factors of the world, but this year they are changing wording a little bit. 10 global health issues to track. That means observe carefully. So there's a few 10 items, but look at this. One is providing global leadership of science and data. We have seen quite few um, head of states who ignored science. But science sometimes was quite late to provide data, or data was not quickly come to make science possible. So this is very important issue to be tracked in 2020. And then revitalize effort to tackle communicable disease. I think the way to tackle is not merely giving vaccines, but collect information as soon as possible, identify where um, core source of infection locates in the community. That kind of information is needed. Then Japan, how Japan responds to COVID-19. As I said, that Japanese death rate is much better than G7 counterparts, but not good enough among Asian brothers and sisters. Former Prime Minister Abe, before departing office, he said that he is proud of Japan model of COVID-19 control. That is, in principle, extensive contract tracing, strong public advocacy of avoiding 3 Cs. C stand for closed space, crowded place, close contact. So that's 3C. And then soft lockdown without strong law enforcement. So that is Japan model. But there is some independent commission was organized and report came out in October before third wave is coming to Japan. And they are concluding that let us prepare for the next wave of infections. And they identified few, or not few, I think quite a lot of weakness which we need to address. One is a speedy collection and analysis of information. Second is clearer role sharing between expert and policymakers, and improved communication both in Japan and abroad, and expansion of testing and treatment capacity. All these are pointing out. And before the counter measures is implemented, the third wave came, and where we are now. So we are now facing, this is COVID-19 tsunami. But if you, it's quite interesting. Life expectancy of Japanese in 2020 is expanded. Why? Because COVID deaths was small enough. But due to softer lockdown, less traffic accident, and people is wearing mask and washing hands. So number of infections and related deaths declined. Therefore, life expectancy was expanded in 2020. And that is further accelerate our aging society. And aging society is our big public and policy challenges. So I call it a silver tsunami. That is Hokusai wooden plate. When he was 70s at the time, 70 is quite very senior. This picture was carved by Hokusai at his age of 70. So we are facing a double tsunamis, COVID-19 tsunami and silver tsunami. And this is aging in Japan. So it's quite a jet roller skate, jet coaster type of populations growth chart. When we came in 20th century, 1901, our population is 50 million. That it peaked to 120 million around 2000, beginning of 21st century, and end of 21st century. That is end of this century, our population will be something like 55 million. So that is 50 million climb up to 120 and coming down to 55. So that is our roller coaster, jet coaster type of populations. But this is by age group. This is persons over 75. This is 65 to 74. And this is age 18 to 64, working population. So if you look at prospect of immediate future, a number of silver citizens defined over 65 does not grow so much, but sharp decline in working people. So that is our problem. So those who are the pensioner is growing, and those who pay for contribution is declining. That is our fundamental problem. So short-term medical cost issue and mobility change is our headache, but the mid-term more effective promotion of health that is coming from data-driven public health is important. And then long-term sustainability of social security system is our policy priority. But this is a phenomenon is not common, only common for Japan. World is growing older. So if you look at populations defined as senior citizens, defined by over 60 years, that is UN-wide definition of senior citizens. So 60 years for us is quite young, but according to UN definition, 60 is already senior citizens, which does include Madonna in United States. So let's look at by 5 years. So that darkest color is countries where 30% or more population is over 60. So in 2015, only countries of senior citizens country is Japan. But to 2020, Germany and Italy and Japan. 25 darker colors glows like this. And 2040, China become a member of silver citizens country. And then middle of 21st century, Iran, Thailand, Chile, unbelievable. These countries is becoming senior citizen countries. Then digitization, that is a concern of this group. I think we have a lot of problem in digitization in public health in Japan. So that is visualized in the case of COVID-19. COVID-19 cases directly go to hospitals or clinic or consult with health center. When hospital diagnosed COVID-19, hospital is by law need to report to health center, and health center report to prefecture government, and then prefecture government has similar health centers. All these data is combined and sent to Ministry of Health. But this is often time, and it is improved, but still some are done by facsimile. So health centers need to input to format by hand. That takes quite a lot of time, and that delays information. So our problem is coming here. And also hospitals report case to health center, but the hospital claim to health insurance payment fund. So this, how many patients of COVID is seen and what kind of treatment is given. That data is coming to this route to health ministry. And there's no communication. That is exaggerated, but very little communication. So public health data come up with facsimile, and this is electrically done, but anonymous, so we can combine with a real patient. So that comes from fundamental issue is that in Japan, privacy protection is giving very high priority. And also system is designed in decentralized manner. So each prefecture government has different system. So it is very difficult to standardize reporting. So all this is reviewed by COVID-19. But mass data is useful sometimes. That is example of JAGES, Japan Gerontological Evaluation Study. They are using mass data of nursing care insurance. So that gives a very interesting and unbelievable of results, showing that those who are enthusiastic athletes, like triathlon persons of age over 65, does not live long. Relaxed sport persons, like walking twice a week, is the most best health performer. So all such interesting data is coming out of this. So I think in COVID, deficit of timely provision of data by it was not possible in Japan due to a delay in digitization of public health information. And also we have learned that COVID is concerned, public health is expanding this domain. Used to be public health is provision of preventive services and setting policy at international organizations such as WHO, but there is many NPOs and private public partnership is growing for research and development, infrastructure building and financing of public health. This area is growing very much. And as I said, that health is now utilizing many data available in other sectors. That is important to design intervention to bring people to healthy side or poor side. So that is new public health, which I am talking about. But challenges exist in Japan. Black swan and gray rhinos and elephant in the room. That is challenges. Black swan. So Japan people feel that, well, big disaster is not coming. So that is, we feel that after 70 years of no war, we are accustomed to be peaceful daily life. So not prepared well for emergency. And then gray rhino is concerned. I think that is typical in information system. So we know that is problematic. But the system is designed in decentralized way, and is many political opposition to a centralized information system. So that is our challenges. And then last one is elephant in the room, is that nobody says that, well, other Asian countries is performing very well, and in many sense much advanced than Japan. But the people knows, but it's difficult to voice it. But opportunity lies still. So we have a quite good leader actually, and our Prime Minister Suga is very practical and committed in information technology advancement, and also his power is some delegated to Mr. Kono. He is a very unorthodox politician and is a brave man. And this person is a chief advisor to our government in COVID-19, Dr. Omi. He is, by the way, one of Keio's related person. And Kamikawa, and a woman, she is very brave in also digitization. She was ex-justice minister. And Tedros, and here, that is one shot in executive board. And if you look at right bottom, Dr. Fauci and myself appears together with the Director General. Dr. Fauci declared return of the United States to international cooperation. It was welcomed. So the time is coming to revitalize global public health. And then for the Keio is concerned of myself and Keio. Keio is engaged in an aging research hub of Asian Pacific Rim Universities Association. And myself is engaged in organizing Active Aging Society Conference organized by Nikkei and Financial Times. And also I'm working with ELIA, Economic Research Institute for ASEAN, to organize a collaborating platform of medical care cooperation. So that is what I have prepared. Thank you very much, and I'm ready for question and answer. So over to you, Mr. Chair.